Have you ever gone to your doctor with a slew of symptoms, fatigue, anxiety, insomnia, maybe you're having joint pain, muscle aches, maybe even your digestion's off, and they run a bunch of blood labs and you're excited to go in for the results and you're told everything's normal? I'm Dr. Tenesha Wards with Infinity Wellness Center, and I have a couple thoughts on why that's the case. The first is most annual blood labs, comprehensive panels, aren't that comprehensive. In our clinic, we run much more, about 3 times more what's done in your annual blood labs. So where your practitioner may run your annual blood labs and they're just running bits and pieces, we're digging much, much deeper. For example, you go in maybe with weight gain, fatigue, your hair's thinning, and they're like, oh, let's check your thyroid. They typically just run a TSH. That's a thyroid stimulating hormone. That doesn't even come from the thyroid. It comes from the pituitary gland. The pituitary gland stimulates the thyroid to make T3 and T4, and it could be out of balance, but I've oftentimes seen a normal TSH with all their thyroid hormone levels low all the time. Where we run things like the T3, the T4, the free T3, the free T4, which is really the form that we need to know is in the right range. We also look at things like autoimmune thyroid. Your body may be attacking its own thyroid and the body just can't regulate any of your thyroid hormones, but your TSH looks fine. So the TSH really is a pituitary function marker. Another thing we notice that is often missed is inflammatory markers. We look at things like C-reactive protein, homocysteine. We also dig in and look for underlying infections and viruses. We find Epstein-Barr virus all the time, an active case that could be absolutely the culprit for things like fatigue, brain fog. So these are often labs that are just simply overlooked and missed. They're really looking at just some very basic metabolic panel markers and cholesterol. They're not really digging much deeper. So that's the first thing that I find, is that they're just not running enough blood work. You have to be sick enough for them to run a thorough panel. And oftentimes, if nothing shows up in that first preliminary panel, your doctor doesn't dig deeper. That's one issue. The other is we look at blood work in functional nutrition a little different. We look at the ranges differently. So in Western medicine, the lab ranges, the range that the lab gives you may be from here to here. If it's out of that range, it's considered a pathology, which is a synonym for disease. So your thyroid stimulating hormone, or your T3, might be just barely in range, but you have all the thyroid symptoms. Your thyroid is not working well. So we're looking at a much tighter range called the functional range. So if something's a low normal or a high normal, for example, liver enzymes, oftentimes I see the liver enzymes are barely in range, and this person has all the signs of like liver toxicity. They're having skin issues, they can't digest fat, they're having loose stools, they have pain under the right side of their ribs. They have all the issues that we would look at and say, oh yeah, we need to do a liver cleanse. We need to clean out some of the toxins, but they're not out of range to a point where it's a disease. So nothing's done. So that is definitely the biggest difference, is looking at a pathological versus a functional range. We want your body functioning at its most optimal versus your doctor saying, oh, well, it's on the low end. Let's wait 6 months or a year and check it again and see when it's out of range, when it is a pathology and it's a disease, then we'll do something. And then typically their solution is, drugs or surgery. We say, no. It's starting to go on the low end. Something's dysfunctioning in the body. Let's figure out what it is and bring you back to a functional level where your body's working at its most optimal. So if this is you, if you've gone to your doctor and you're told everything is fine, but you know in your core, something's wrong, something's out of range, it's time to find a practitioner that will look at a functional blood chemistry and figure out why your body's not functioning the way it should. So again, my name is Dr. Tenesha Wards with Infinity Wellness Center. If you have any questions on that, definitely just put some questions below, and we will do the best we can to help you figure out the next right step to figure out the core root issues of your symptoms.